Hey everybody, Richard Wolf here with Grace Agency, and I'm coming to you with a part 2 video of my Medicare options made easy. In the first video, we talked about the parts of Medicare, Part A, B, C, and D. Gave you a little overview of what they cover, what they do. Now we're going to review that real quick, and we're going to talk about the numbers and what your options are. So, are you ready? Hang on tight and get ready to go. First off, let's start with option 1 side. This would be Medicare Part A. Part B is your main Medicare coverage. That's your insurance. When you turn 65 and or get Medicare because of disability, your insurance now is Medicare. Part A and Part B. A is hospital, B is doctors, testing, lab work, and services. Now, what is that going to cost me, Richard? Well, let's talk about that real quick. Your initial cost for Part B is going to be $148.50. Your initial cost for Part A, are you ready for it? $0. You paid into the Medicare system all your life. Your employers did as well. And now there's no cost for Part A, but you will have a small premium of $148.50 for Part B of Medicare. And we talked about what those covered before. Then we look at Part D, as in drugs. Part D is going to be somewhere between $13 to maybe $90 a month. Depends on your medications that you take. And that's going to be the best indicator of which plan is best for you. Do not allow a friend, a relative, a neighbor, someone else you know that's on Medicare tell you which plan is the best. You need to have your medicines looked up, plugged in and compared in all the Medicare prescription drug plans that are in your area. That way you'll find out which one covers yours at the lowest cost, lowest deductibles, etc., etc. Then, the next step on option 1 over here is going to be your Medicare supplement. Right here. Medicare supplement. For 2021, the best plan to get, or the best plan you can get, is a Plan G as in golf. Now, you probably can't see those little numbers there. Should have made them a little bigger, huh? Let me write them for you. A Plan G right now is about $120 per month for a male and about $100 a month for a female. Now, this is in Louisiana. Your area might be a little different. Could be a little more, a little less, just depends. But at $120 a month, that's going to cover all of the medical, hospital coverage deductibles. It's going to cover all of the 20% deductibles under Part B of Medicare, with the one exception of the Part B deductible, which for 2021 is $203 a year. So you'll pay the first $203 every year. Doctor visits, testing, lab work, whatever it is. Then the rest of the year, everything is covered underneath these premiums that you're paying here, whatever they might be. And these premiums are based on 2 things: your zip code and probably the health of the population. Now, they do go up every year because most likely you're getting a year older. I don't think we can stop that just yet. But that's the way that works on the Medicare supplement side. So in option 1, you've got $148.50 for your Medicare. You've got $13 to $90 for your prescription drug plans. And then you've got $100 to $120 depending on if you're male or female. And then just your $203 a year deductible. This does change with Medicare every year. They can increase this and the Part B premium at any time they choose. But normally that's on an annual basis. So with these numbers in mind, $148.50, let's use $13 and then $120 as a worst case scenario. On this option right now, with what we're talking about, these numbers, you're looking at about $281.50 per month, and then all you'll pay out of your pocket is 2 things. 1, the $203 Part B deductible, and then 2 would be the co-pays for your prescription drugs. Put that in there, co-pays. That could be anywhere from 0 to 5, maybe $10 for generics, or anywhere from 47 to 100 or more possibly for tier 4 or 5's name brand drugs. So per month, about $281.50 on this option. This is option 1. Option 2 is Part C or Medicare Advantage. Let's talk about that for a minute. Now, Medicare Advantage, basically, again, if you remember from a previous video, is where you allow a private company to manage Medicare for you. That could be Anthem, it could be Aetna, could be Humana, could be Blue Cross Blue Shield, could be Cigna, could be WellCare. There's a bunch of companies out there that do that kind of work. So don't get too tied up in the company. First, take a look at the plan. And what do you mean by that, Richard? Is the plan I'm looking at an HMO? A PPO? Some areas of the country do have a private fee-for-service called a PFFS, but there's not a whole lot of those out there. And that's a little bit of a hybrid, if you will. But anyway, most often your choice will be HMO or PPO. Keep in mind, an HMO says you have to use that network of providers. Okay? Have to stay in the network. If you go out, you're going to pick up all the costs, 100% of them. Okay? If they're not in the network of the plan and the company you chose. However, on the PPO side, so that's HMO, PPO, says you can go out of the network, it's okay, but you will pay more when you do that. So a copay might go from $40 to $50. Or in some cases, it might go from a flat copay to a percentage of 30 or 35%. It depends on what the benefit is. So again, Medicare Advantage, the all-in-one plan, where you allow a primary company to manage Medicare for you, and then they'll change all the 20% in deductibles into flat copays. As an example, your monthly premium on these plans could be as little as $0, and it could go up to much as $110 or maybe even more per month. Some plans even go up to maybe $200. But the copays do adjust from plan to plan. So make sure whoever you're sitting down with, if that's me, great. We're going to walk through all the scheduled summary of benefits for every single copay for the entire plan. On average, a primary care doctor is going to be between $0 and $5. A specialist will be somewhere between $35, maybe $30, as low as $30, up to $50. Emergency room, flat $90 copay. No matter what they do for you, it's an all-inclusive number. Urgent care, anywhere from $35, maybe $50 as well. And then you get into more expensive stuff. Your outpatient procedures or MRIs or CAT scans can go up to as much as $250. And then hospital stays, they can range anywhere from $175 to maybe $250. In some areas, might even go up to $325 per day, with a maximum number of days that you would be billed for a given hospital stay. And again, that's when you go through the summary of benefits with the agent you're talking with, and we walk through each specifically. I like to give examples and scenarios of how it plays out so you really understand how it works. And then you will have some costs that will stay at a 20% cost. Typically your durable medical equipment, your dialysis, your chemotherapies, prosthetics, some of your Part B stuff, drugs, Part B diabetic supplies can be as much as 20%. But the other thing these plans do over here is they're going to throw in the extras, right? We talked about that before. Dental, vision, hearing, over-the-counter, and health club. Now, that's not a reason to choose these plans, but I bring that up simply to make sure that you understand this is an extra perk you get over here that you do not get on this side of the page. Over here, any of that kind of stuff would be completely out of pocket, and or you'd buy an independent, say, vision or dental plan to help you cover those costs. So, I know that might have been a little quick. I know it might have been possibly too fast for you. But the point was to give you a big picture overview of this. My encouragement is for you to reach out to me. We'll set a time to visit, whether it be over the phone, virtually by video call, or face-to-face, whatever's easiest for you. And I'm going to walk through all of this information, make sure you understand both options, whether it be the Medicare Supplement and Drug Plan, or the Medicare Part C Medicare Advantage option. I hope this is giving you kind of a good overview, a good understanding of how it works to some degree. In the next video, I'm going to come back and give you another quick overview and some options. And I'm also kind of relate it back to possibly your group benefits costs, and to show you how to maybe compare the two together and see which one you feel like is a better fit for you. especially for those folks who are not ready to retire and stop working just yet, but they do want to save a few dollars on their healthcare expenses and their insurance costs. So stick with us. Reach out if you need anything from me, Richard Wolf, that's rw@graceagency.com, or call me at 337-322-0415. Thanks so much, and we'll talk soon.